Are you planning to go for same-day surgery interviews? Are you currently working as a same-day surgery coder, but you are having confusion about coding excisions? Do you want to know the difference between integumentary system excisions and musculoskeletal system excisions? If the answer is yes, this video is very helpful for you. My name is Harish Gupta, medical coder, process trainer and content creator for FastCoder 21 free medical coding YouTube channel. In my channel, I will provide latest updates about IC10CM, CPT and IC10PCS as well as HICPICS. And also I will provide latest information about APCs, free CE webinars as well as latest jobs updates spread over USA, India and UAE. So today our topic is CPT musculoskeletal system coding scenarios. So basically in this scenario and in these sessions we are going to know two scenarios. One is for musculoskeletal system excisions. So another one is for ORIF. If you want to know complete tricks in order to code excisions and fracture repair, please watch this video until the end. So our topic today is CPT musculoskeletal system coding scenarios. So this is the first scenario. So Ron has a mass growing in his left flank for several years. Okay, it has finally gotten significantly larger and is beginning to bother him. He is brought to the operating room for definitive excision. An incision was made directly overlying the mass. So the mass was down into the subcutaneous tissue and the surgeon encountered a well encapsulated lipoma approximately 4 centimeters. This was excised primarily bluntly with a few attachments divided with electrocautery. How do you code this scenario? Here our answer is 21931 and for IC10CM we need to use D17.1. Now we need to find keywords in this scenario. First, go ahead with first line here. So our location is flank. So flank is the keyword here. And next, second keyword is excision. So here physician is performing the excision. The reason for excision is mass. So the reason for excision is mass. Physician is performing the excision. And this is the another keyword here. So physician has created one incision on the mass. Okay. Then subcutaneous tissue is the keyword here. So here physician is going into subcutaneous tissue in order to excise the mass. And next keyword is lipoma. So lipoma is basically a benign tumor. So most of the time it will occur in the soft tissues. And next one is diameter of the lipoma. So it is 4 centimeter. So total we have nearly 6 to 7 keywords in this 5-line scenario. So this was excised. So this is also one keyword. So here physician confirming that I have excised the lipoma here. Primarily bluntly with a few attachments divided with electrocautery. How do you code this scenario? So in order to code this scenario, first we need to find the keywords. So we have done finding the keywords here. First is the mass, second one is flank. So next one is for excision. This is the procedure physician is going to perform. So the reason for procedure is mass. So this is the third keyword. So here physician is starting his procedure by creating an incision here. And next one is the depth of the tissue or physician entered is subcutaneous level, and here it is lipoma. So physician has decided that it is a lipoma. So lipoma is a benign tumor. Most of the time it will appear in soft tissues only. And this is the another keyword. So this is for dimension of the lipoma. So which is 4 centimeters. So here this is also one keyword. So whenever we code an operative report, we need to ensure that physician has performed the intended procedure. Why means physician has mentioned here excision, but sometimes what happens, so after physician start the excision process, if there is any problem with the patient or with the equipment, physician will stop the procedure. So in order to ensure physician completed the intended procedure, we need to check the keyword here. So this was excised means already physician excised the lipoma. So without any doubt, we can code for excision here. So excision of the lipoma until subcutaneous tissue. So in this scenario, we have two codes, 21931 and D17.1. So how do you check this 21931 in CPT index? So directly you will go to flank or back in the CPT index. Under flank or blank, you can find excision. Under excision, you will find tumor. So otherwise, second option is directly you will go to tumor in the CPT index, and there you will find excision, and you can find the location. So where is the location here? So it is in the flank area. So like that, you have two options. Otherwise, third option is directly you can go to your CPT book and you can find the correct CPT code. So if you see here, excision, tumor, soft tissue of back or flank, subcutaneous less than 3 cm, and 21931 is for 3 cm or greater. So based on our keywords, first our keyword is location. Okay, location is flank. So next we need to check whether it is a tumor or any type of skin organ. So lipoma, ours is lipoma. So it is a benign tumor, and physician is performing the excision based on our keyword. And physician has excised this tumor until subcutaneous level. So based on the documentation. So here subcutaneous. So next our keyword is dimension of the mass or lipoma. So which is more than 4 centimeter. So if you check 21931, this is for 3 centimeters or greater, as ours is 4 centimeter. So we need to code 21931 as correct answer. See here, mass. So instead of mass, we can think it is a lipoma, and location is flank. So next one is excision. The next one is like subcutaneous tissue level. So next one is lipoma. So lipoma is a benign tumor, and this 4 centimeter, as we have discussed, our code description is having 3 centimeters or greater. So we need to code here 4 centimeters. So like this, you can code your excisions from like musculoskeletal system very easily. So if you have any confusion or concern, please mention in the comment section of this video. So I will try to explain more clearly. Next we will learn about one fracture case. So here preoperative diagnosis, left scaphoid fracture. Next, open reduction and internal fixation of left scaphoid fracture. So guys, if you are trying to enter into surgery coding or same day surgery coding, fractures are very common procedures along with excisions. So if you want to code fractures properly, you need to find few keywords. So in this session and in this scenario, we are going to know all those keywords now. So whenever you see the fracture, just you need to know why the physician is performing the procedure. So here patient is having the scaphoid fracture. So if you see here in these images, patient is having fracture on the left side of the scaphoid. So this marked area is the scaphoid. So here patient is having the fracture. So based on heading, physician is performing open reduction and internal fixation of left scaphoid fracture. So as soon as we see the open, so we need to identify that it is a open procedure, and try to identify and remember one important thing is that we never code from the type of the procedure. So we always need to code from the body of the OP report, or usually we will call it as description of the procedure. So first of all, we will read this one and we will find the keywords. So the patient was brought to the operating room, anesthesia having been administered, it's fine. So the left upper extremity. So this one we need to make it as a keyword. Why means in CPT coding, laterality plays very important role. So in order to provide correct laterality along with our CPT code, we need to have identification of laterality of the procedure physician is performing. So this is the first keyword, left upper extremity was prepped in wrapped in sterile manner. The limb was elevated, exsanguinated, and a pneumatic arm tourniquet was elevated. An incision was made. So this is the incision is the keyword. As here physician has mentioned open procedure, correct? So in order to perform the open procedure, physician needs to create an incision. So here physician has created incision. So directly we can think that it is a open procedure. Next, made over the dorsal radial aspect of the left wrist. So why means, as this scaphoid fracture is on the wrist area, physician is making incision on the left wrist area. So skin flaps were elevated, cutaneous nerve branches were identified and very gently retracted. So in order to perform the open procedure, physician needs to keep side all the nerve branches. Here physician has done the same procedure. Retracted means he kept away the nerve branches. So the interval between the second and third dorsal compartment tendons was identified and entered. So as in open procedure only, we will find all these nerve branches and tendons. In closed procedures, we will not find all these things. So in order to find and in order to identify whether procedure is open procedure or not, you need to identify first keyword is incision. Next, these nerve branches and tendons. So these are visible means these are open procedure. So the respective tendons were retracted. Okay, fine. So the dorsal capsulotomy incision was made. Again, so previously physician was created incision on the dorsal area of the wrist. Here physician is making incision on the capsule area. So capsulotomy means incision on the capsule. So and the fracture was visualized. So why means fracture area is covered by the capsule. So here in order to open the fracture site, physician has created capsulotomy. So then there here physician has saw the fracture. See here fracture was visualized. So there did not appear to be any type of significant defect at the fracture site. So a 0.045 Kirschner wire was then used as a guide wire extending from the proximal pole of the scaphoid distalward. So here physician is starting inserting the pin. So here physician has opened the fracture site and he inserted the Kirschner wire. See here open reduction and internal fixation. Open reduction means here physician has made the incision, so this will comes under open reduction, and internal fixation means physician here using the wire, physician is stabilizing the fracture. So the guide wire was positioned appropriately and then measured. A 25 mm ip-drg drill bit was drilled to 25 mm. A 22.5 mm screw was selected and inserted and the rigid internal fixation was accomplished in the fashion. So physician initially used the wire and then afterwards, so based on our type of procedure heading internal fixation, using the screws, physician has performed the rigid internal fixation. So this was visualized under the OEC imaging device in multiple projections. The wound was irrigated and closed in layers. So here we will not code any wound layer closes. Why means, so as it is having 90-day global period, we no need to code repair of the fracture site. It is included in the fracture code itself. We no need to code separately. So sterile dressings were then applied. The patient tolerated the procedure well and left the operating room stable condition. What code should be used for this procedure? So for this we need to append 25628 LT modifier. So here you need to understand how do you find 25628. So directly you can go to scaphoid and you can check for fracture and open procedure. There you will find 25628. In the CPT index, next keyword is fracture. Under fracture, you can check for scaphoid. If you don't find scaphoid, so you can check for carpal also. Why means this scaphoid comes under the scaphoid is the carpal bone. So like this, in same day surgery coding, excisions and fractures are very important. So I hope this session is understandable for you. So if you have any concerns, you can mention in the comment section of this video. And also please like, comment, share and subscribe FastCoder 21. Always my intention is to educate the coders in order to make complex subjects or complex topics into simple.